So this is a diverse group. I was glad to see so many hands go up around urban planning and community development, but there are a lot of folks from the health sector, public health and health care. And so those of you may not be as familiar with this kind of work. And so I'm going to start with what is community development. If you Google it, as I did before coming here, you'll find a lot of different explanations and terms and descriptions for what it is and who's involved. It's not easy to define in just a few words or sentences, but the best way that I know to capture the essence of community development is that it's really about driving investments into low-income communities to improve the quality of life for all residents, creating safe, attractive, economically viable places where all people can thrive. It may look different in different places, but it should have the same core components. Engaging local leaders and residents in creating solutions that address the physical, social, and economic needs of low-income neighborhoods, a lot of what we heard this morning in the keynote, from housing to education to safety, transit, employment, and health, and creating strong cross-sector collaborations, public, private, and nonprofit, that includes real estate developers, financial institutions, philanthropy, community-based organizations, government, and others, to target investments into struggling neighborhoods that more traditional investors often find to be too risky. So just using LISC as an example, we function as an intermediary, often known as a community development financial institution. There are probably nearly 1,000 of these CDFIs around the country in different shapes and sizes. And basically, we aggregate financial resources from a lot of different public and private funders and investors, and then deploy these funds along with technical assistance and capacity building support, and using a lot of flexible, low-cost financing tools, everything from grants and loans to equity investments and credit enhancements, all to help community-based organizations like the ones on our panel today carry out a very broad range of neighborhood revitalization projects. So the community development movement began about 50 years ago with a very specific focus on affordable housing as a targeted strategy for stabilizing distressed neighborhoods, as a way of addressing concerns about middle-class population loss, high crime rates, disinvestment in urban centers in the 1960s. And since then, the industry has financed literally millions of affordable homes all around the country. But the community development world came to understand that better housing alone is not enough to help transform a struggling neighborhood into a thriving one. And our work really is about creating viable places to live in the broadest sense. So community development has gone well beyond its original housing focus and now works in a more comprehensive way, addressing the need for jobs, economic development, community safety, and by helping to plan and finance everything from early childhood centers and schools, grocery stores, recreation facilities, health clinics, and other community, commercial and retail spaces. And the big aha moment for community developers, and for LISC in particular, is that this comprehensive approach to neighborhoods is really all about health. Just a few years ago, I don't think anyone at LISC, certainly I was not using the term social determinants of health. Today it's part of our vocabulary, and we understand how our work addresses so many of the root causes of poor health in low-income communities, because our work is about creating neighborhood environments that support healthy living. This realization has definitely given us some new momentum and has led us to be much more purposeful in this work and how we think about making investments with a specific eye toward health. That's meant a couple of things: moving away from one-off transactions that might finance a grocery store on one end of town, a playground on another, thinking how all the pieces fit together in a more integrated way to support a community's well-being. And also going beyond our industry's primary focus on the bricks and mortar, working to connect the dots so the physical assets that we do help put in place are well used in offering a web of social and economic services and supports that residents need. And so I'm going to offer some examples of how this has been playing out in different places across the country, and then later you'll hear about what's happening right here in Rhode Island. So I'm going to start in Eastern North, one of LISC's target neighborhoods in Philadelphia, a neighborhood with a poverty rate of 64%, unemployment about 30%, 3 times the city's rate. 84% of families live in single-parent households. And the neighborhood, not surprisingly, has much higher rates of obesity, diabetes, hypertension, and asthma than the rest of the city and state. So LISC worked with local partners in Eastern North to literally map out the community block by block, looking at assets and needs, and then trying to deliver financing and technical help to address gaps and basically create a better place to live. And so we've invested in over 400 affordable homes, a supermarket, a credit union, and other community facilities. And Paseo Verde, which is pictured here, is a great example of a community development effort that was developed for multiple uses and definitely with health in mind. It was developed on a former parking lot at a transit hub. It combines mixed income and supportive housing and has commercial space that has a federally qualified health center, a dental clinic, a pharmacy, and a financial opportunity center that helps residents with employment, personal finances, and access to income supports. So there's a connection to health on so many levels. There was green housing design that protects against poor air quality, mold, and toxins, and families, upon moving in, immediately report fewer issues with things like asthma and respiratory illness. Being right near a major transit hub means it's so much more likely that people are going to walk rather than take cars, and it provides easier access for those who don't live at Paseo Verde to come and use the community and retail services and supports. The on-site health clinic obviously provides easy access to primary care. It also carries out home visits in some of the apartments. But when we connected our community development partner with the health clinic director, we found that a lot of the residents in and near Paseo Verde were not actually using that clinic. And so we went a step further, again, trying to connect the dots, and funded some community organizing so that our community partner could help residents with opportunities to access health insurance and in other ways access the services of the health center right near them. Moving along to East St. Paul in the Twin Cities, another target neighborhood, we had been investing in a lot of different neighborhood improvement projects, but they were really isolated efforts in different parts of the neighborhood, and we felt like they needed to be tied together more strategically. So in this neighborhood, we are supporting what we're calling a community health advocate, basically a program staff person wearing a health hat, whose job it is to think about every day, how does health fit into the ongoing community development work in this neighborhood? And it's part of a national pilot that we're implementing in some neighborhoods around the country. And in East St. Paul, we were able to bring financing both for the renovation of an affordable housing complex, Rolling Hills, as well as the expansion of a federally qualified health center right down the street. But what we found was that the housing sponsor and the health clinic, they hardly knew each other. The residents of the housing were largely recent refugees and immigrants who speak dozens of languages and have very diverse cultural practices. And they were mostly taking 3 and 4 buses to find primary care all the way on the other side of the city. And so we brought funding in to equip an exam room right on site in the housing. Our community health advocate has been facilitating the relationship between the housing sponsor and the health clinic, and also has involved residents to help make decisions about things like how best to use the exam room. They were going to do it on a Tuesday. The residents said, well, we're working 3 shifts. We need to have it on a Saturday. This collaborative process led to opportunities for increasing access to healthy food by planting gardens at the housing, creating venues for recreation and exercise, bringing in ESL classes and childcare services. And in New York City, we're implementing an initiative called Communities for Healthy Food NYC to integrate healthy food strategies into the work of 4 of our community development partners in 4 high-need neighborhoods around the city. So we're drawing on the existing assets of these community development organizations who have been in the neighborhood a long time, have close ties to the residents of the housing they've developed and now manage, and are already providing a lot of social and economic supports. So here are boots on the ground, our community healthy food advocates, sort of a takeoff on our community health advocates, but with a food lens in this case. And each of our partners has assessed local needs and now are implementing a range of strategies to integrate healthy food at every level. So that's everything from nutrition education and cooking classes for residents, training housing managers and staff in food preparation, gardening, or again, nutrition, linking small business programs to food-related jobs. They've trained residents to become everything from farm stand operators to community chefs. bringing early childhood centers and schools more fresh, healthy food from local sources, and tapping the community and commercial space that they have some control over, usually on the ground floor of their housing developments, to introduce new food venues. And in one case, that will be a grocery store. In others, there have been food hubs and other smaller youth markets and other businesses. And there are a multitude of efforts like these happening all around the country, and as you'll hear in Rhode Island as well, that build on these kinds of community development resources, not only the financing, but also connections with residents and the ability to bring in partners from across many different sectors at the neighborhood level. So just two quick examples. In Richmond, California, our partner, Pogo Park, was working in a neighborhood that had no safe places, no safe public places for kids to play. They worked with over 500 residents and ended up transforming a neglected, vandalized, trash-filled playground that was occupied by drug dealers into a clean, safe place with a tricycle path, loose parts like sticks and sand and other things for creative play. They hired local residents to work as park staff. They partnered with the local law enforcement to make the surrounding area safer, and they even got a city waiver to allow the sale of food on site, which of course for them means healthy snacks. And then in rural Roseburg, Oregon, a rural partner of ours took over a vacant restaurant and renovated it half as a community kitchen and half as a local goods store. And so farmers use storage space in the kitchen, food entrepreneurs prepare foods, and all of it can be sold in the storefront that is located on the ground floor of an affordable housing development where 99% of residents receive SNAP benefits through food stamps, and 35% of them are obese. So you can see why community developers are increasingly defining their work as a strategy for addressing the social determinants of health to promote positive health outcomes in the neighborhoods where we work. So we know health is connected to neighborhoods, not just individuals. Community development has already invested billions of dollars in neighborhood improvement projects that address the physical, economic, and social factors that have such a big impact on health. And as I've said, from housing to jobs to food markets and clinics. And now that we understand this connection between community development and health, we can be more deliberate and intentional about how we make our investments, like in the projects that I highlighted. And the low-income communities that we're designed to serve are exactly the same neighborhoods that have residents with the most chronic health issues, are the highest risk, have the least access to health-related services and supports. So we are concerned about the very same people that the health sector is concerned about, and for the first time, we're trying to get out of our own silos and partner with public health and health care to try to address these needs collaboratively. And to carry out our social mission, as a financing organization, we bring a discipline, sort of business discipline to our work. So we know how to craft innovative financing vehicles, we know how to structure sound investments, and through our technical assistance, we bring capacity to our local borrowers and grantees that actually remains in the neighborhood. So community development is one of the few industries that is right at that intersection of people and place, and so we are now seeing our role as transforming places so that all people can live a healthier life.
I came on board to the Rhode Island office to build partnerships between police departments and community development corporations. So that was kind of a little one-off as to what LISC had been doing, and we kind of saw how this could really impact kind of safe places to play, or people that would be able to feel safe going out and things like that. But it wasn't really, it didn't come to the full front of that, this aha moment of everything that we do is connected to health, until we began to see the connection as we developed our Building Sustainable Communities initiative, which is an initiative that we're doing. It's a holistic community development strategy designed to improve the quality of life for Rhode Island communities. It has 5 major goals, which is investing in real estate, like Amy had mentioned, about increasing family income and wealth, stimulating the economic development, improving access to quality education, and supporting healthy environments and lifestyles. We build on this by empowering neighborhood residents and community leaders to become strong voices and active partners in their neighborhoods and to shaping their neighborhoods. And how we did this was together these groups, we bring together community development corporations or other community-based organizations as a convening agency, because we realize as a intermediary or as someone that is not of the neighborhood, that we need to work with people that are of the neighborhood to be able to do the work that we can do. And that we cannot come in and just say we want to do this. We want to come in and say, what do you want us to do? How can we help you improve your neighborhood? What can we do? And so we did this process, and through the process we created what we call community contracts. And these community contracts clearly articulated the local goals, local objectives, but was all based upon a shared vision of what the neighborhood wanted. We interviewed hundreds of neighborhood residents. We had focus groups with businesses. We got all kinds of ideas. We've got all this data. We had over 2,000 little snippets of what people were interested or what they thought was the strengths or what they thought was the weaknesses in their neighborhood. And then we tried to figure out how we put this all together. And we kind of, and themes developed. And what's very interesting for Rhode Island, LISC, I believe, is that these are two of our pilot neighborhoods. We've done it in a couple of other neighborhoods right now, but I think when I say, and when I talked to Amy last night at dinner, I said, and it's really fascinating because health comes up as a theme in every single one. It might not be the same. It might be health and safety, it might be healthy housing, it might be access to health care, but health always rises as one of the themes in all of our community contracts. And she looked at me and she said, yeah, that didn't happen around the rest of the country. So I found that quite interesting. But we did have our aha moment there. What LISC then tries to do with that is we then connect these local communities with this community contract that has all these strategies and action items, and we get the resources and the expertise they need to help implement these things. And we have from childcare to after-school programs, from community policing initiatives to senior housing or healthcare, from retail stores to commercial corridors to greenways and bike paths and parks. And it was really, for us, it was, you know, that this health, you know, that emerged, it didn't emerge the same way. But having health as part of the community contracts, or other places call them quality of life plans, it helped give each neighborhood a platform. This was this great platform that they could build on and leverage many other resources that help implement these ideas, or they help expand these ideas. Something called that ripple effect, that you have this idea, you have this nice resource, everybody wants to come in and help build on it, help expand on it. And what we're very excited by right now is that to be part of the Department of Health Equity Zones, to bring the same process that we did to Pawtucket and Central Falls, but to do it with a bigger health lens, to really look at it through that kind of health context. So we're very excited about that. And so each of the neighborhoods that are represented today, they're going to share with you some of the projects that have emerged from these community contracts, from the work, as well as the other initiatives that have come into their neighborhoods because of what's gone on. And so first up will be Tina, and I am going to pop up and do some slides for them so you can see nice pictures.
Hi, good morning. Can you hear me? As Nancy said, my name is Tina Shepard. I'm the Director of Community Initiatives at Oneyville Housing Corporation. I think we've heard a lot this morning about how really doing needs assessment in the community you serve is extremely vital for the work that you're going to be doing. And Oneyville Housing has done a tremendous job, as well as with our partners, doing community needs assessments with our residents and community stakeholders. From 2007 to 2010, with the LISC initiative, we actually spent 3 years gathering information from residents and stakeholders to produce our Oneyville community contract, which has 6 key areas to focus on with goals and strategies. And this is literally our go-to guide. This is how we do things in Oneyville, as well as what our partners do, because a lot of our partners had roles in this contract. So, you know, we are actually in the process right now of updating it, and we're hoping to have the updates done by December so we can present the updates to our residents in a community talkback. Because residents will always say, you know, you do a lot of assessing and asking questions, but can we see the updates? So, we're providing that with them, and we've started going through it, and we're like, oh, we can check that off. We can check that off. It's amazing to see that the work that has been done since this has been put in place. We also did in 2011, we did another needs assessment with the community where with the health department, and we actually devised the Oneyville Action for a Healthy Community. Now, with both of these initiatives, we were able to really extrapolate some really important themes that our residents had suggested or that they desired to have in Oneyville. And a lot of that has to do with some of the things you've heard this morning. So they really wanted to have more physical activity in their lives and for their families, but either the roads weren't safe enough or there wasn't enough space, the parks might not have been up to par for them to be doing physical activity. We also heard that there needed to be an improved police presence, and not just presence, but they also needed to be engaging with residents. It's one thing to see them driving by on a call than to actually seeing them sitting there talking to residents, especially young people. We also heard that they wanted more space for gardens. They wanted that more, we had 2, I believe, at that time when we started this process, so they wanted to have access to healthier foods. They also spoke about having a bike path or an extended walking path in Oneyville. And also we hear a lot, and we still hear it today, about having not enough resources for our young people in Oneyville. They wanted some more organized sports. They wanted low-cost activities for their children to be involved in. So we received the Community Health Equity and Wellness Grant a couple of years ago, which really enabled us to focus on some of these concerns that we had and suggestions that we had from residents. So through the CHU grant, we were able to continue focusing on redevelopment of blighted and vacant properties in Oneyville, especially our Jocelyn Park, which is one of 3 area parks in Oneyville, and we are taking it piece by piece. No, you can stay right there, thank you. Piece by piece. So we started with the garden area, we created a garden, and then we moved on to the soccer court, which was just finished last July. Our next phase will be the splash pad, then the basketball court, and then the playground. So it's a piece by piece because it's a multi-million-dollar project, and we don't have multi-million dollars right now. So we're taking it one thing at a time. And our residents will get a little impatient, but we try to keep them abreast of the situation and let them understand that we're trying. It's a process. We've also been able to create the garden space. We've been promoting physical activity and walkability. One of our key partners in Oneyville is the Woonasquatucket River Watershed Council. It took me 6 months to remember to say that. And they have been every year expanding the bike path that now goes from Oneyville to Johnston. So, and we do a lot of promotion about that. We also have several other partners in Oneyville, Recycle a Bike and so forth, that really promotes the use of bikes and how to fix your bikes and how to ride safely. We've also been working with the one school in Oneyville, Debate Elementary School, and Family Services of Rhode Island to implement the walking school bus at Debate Elementary School, which hopefully will launch in a couple of weeks because that's been a process as well. The other initiative, which is in the slides that you'll see, is we have what we call One Oneyville. And it's a landscaping crew. Our stewardship manager hires 3 young people between the ages of 18 and 24 from about April until October, November. And these 3, actually this is last season's crew, these 3 gentlemen were trained in the landscaping business, but they also worked on resume building, interviewing skills, and things like that. And what their primary responsibilities were to actually clean the Oneyville neighborhood, the sidewalks, the shrubbery, the vacant lots where people would dump their mattresses and their couches and their televisions. And also, we have a small district, business district in Oneyville, which we call Oneyville Square. So they've spent the last 3 years really kind of sprucing that up. So we've hung, which you can see on the left-hand side, the Oneyville, the OV banners, which were made by the Steel Yard, which is another partner organization. We've planted some, flowers, which are on the islands of the square, and we've also, with another partner, the Steel Yard, created these trash bins, which were a little bit more eye-pleasing than just regular, dumpsters. You can go to the next one. So this is some of the work, and if you can see on the top left-hand side, now if you're trying to walk down the street, you're going to have to go around the overgrown bush. And so you would normally think that the city would take care of that. So maybe they're busy that week. So here comes Chris and his crew on the right-hand side, and that's the difference they made to make that sidewalk a little bit more walkable. On the bottom is a vacant lot, which we have several of in Olneyville. The left is what it looked like before the crew, and the right side is what it looks like after. And it does make a tremendous difference, especially for our residents. So now this is one of the things that we are very proud of. This was the open space at Jocelyn Park. So on the top, you'll see where the garden, to the left is where the garden space will be, and if you can see on the right, and I tried very hard to find a before picture of where the soccer court, but couldn't find it. So that's about as close as I could get. On the bottom, you see our community partners, which included Youth Build, helping to construct the garden beds and do all the work to put the gardens in place. And now this is what it looks like today. So on the left-hand side is our Jocelyn Community Garden, which now has 36 plots. And on the right is what our soccer field looks like now. And our ribbon cutting ceremony for that was in July. And what really stands out to me, and it was a conversation I had with Nancy, I'm like, what am I gonna talk about next week? Because sometimes when you're so entrenched in the work that you're doing, especially I think in community development corporations, you don't often get to sit back and really understand the full scope of what you've done to make things happen. So that on the right-hand side slide really says a few things about our work. We also have a big initiative from the Department of Justice, the Burn Criminal Justice Innovative Grant, which over the next 3 years we need to focus on reducing crime in Olneyville by doing strategic community policing, hotspot patrolling, really engaging residents in this process and so forth. So there's the aspect of working with the police a little bit more closely. We have the aspect of resident engagement that we're always trying to, enhance and make as best as we can. We also, that also speaks to, okay, now we have some youth program going on. So for April vacation, we had a program that we created called 3 for Free. We provided a free soccer camp, free basketball camp, and a free nonviolence workshop. And so that particular slide says a few things. You can't see the police officers, but there were 5 police officers that came down and took turns at the basketball camp and the soccer camp actually coaching. They didn't show up in their uniforms, they came in their sweat clothes, and they played basketball or they played soccer. The gentleman that actually coached the whole week for us was a resident. And then we had 30 kids show up just for soccer camp alone. So we're trying piece by piece to really address the needs that our residents have said that they need and they want in the community. And as I'm wrapping up, a lot of this stuff and the work that we do with our Olneyville Collaborative, which is a coalition of 30 member organizations in Olneyville, has put us in a place for this year to actually be awarded a health equity zone grant as well. To helpfully help us continue to enhance and provide our partners with the recognition and the tools and resources to do their work that they're doing.
It's exciting stuff. We have awesome jobs up here. So the slides that I'm going to show you kind of start with the places that we've been able to build and the structures that we've put in the communities to start working around health. And as Nancy said, when we did our neighborhood contract through the Sustainable Communities Initiative, health was a reoccurring theme for us, and it came up in many different ways through youth programs, through education, through neighborhood safety. One of the things that came up in our contract was that we did not have enough safe places for kids to go when they weren't in school. And a large portion of our families work 2 and 3 jobs, 2nd and 3rd shift, and having a safe place for their kids to be was really a big piece of what they wanted for their community. So we were able to construct this pretty innovative building. This is called the C3 Center. The kids actually named it. It's called the C3s for College, Career, and Communities. This is a building where we give 6 free apartments to educators and residents. We call them community builders and residents, in exchange for working in our youth programs for 16 hours a week each. So this is one of the places that we were able to build, and I'll go into a little bit more detail later about the health outcomes that. This is in Woonsocket. Yeah. So I'll go into a little bit more detail about the programs that happen here in this building. We can go to the next slide. So another thing that we've been trying to do for many years is wherever we build a community, because we're not just in Woonsocket, we actually cover all of northern Rhode Island. We have communities in North Smithfield and Burrillville. We're building in Foster and Gloucester and Situate, and we're going to be all over the place. But this is one of our neighborhood parks. So we're always trying to make sure that there's neighborhood parks, places where people can get outside, get some exercise, get some fresh air. So this is our neighborhood park in the Constitution Hill neighborhood of Woonsocket. And one of the things that we were able to do a couple of years ago is change it into a green playground. So this is the first green playground in Woonsocket. We were able to build the whole playground with natural materials, which was big for some of our families. A lot of our kids have issues with breathing and asthma, and building with natural materials has a great effect on health for kids with asthma. This is our neighborhood orchard. So not many people would believe that there's an orchard in the middle of Fairmount and Woonsocket. But our community has always had a strong focus on gardening. The history of the Constitution Hill neighborhood is families came from the south to work in the mills, and the families that came from the south were all farm working families. So they brought with them that rich history of gardening. So that's something that we hear about the culture of our neighborhood all the time is more places to plant that are safe, and knowing that the soil isn't contaminated, and then also teaching the kids where their food comes from makes them more likely to eat vegetables and the fruit that's grown there. So this neighborhood orchard is it's one of the places in the neighborhood where people conjure. People love to hang out in the orchard, and it has spurred a lot more focus on gardening and eating well. And I'll go into some of those programs in a little bit too. And Nancy, we can just stay right there. So the whole kind of theme came to move more and eat better. So we were trying to figure out how do we get our residents to move more, be more active, but also to eat better and pay attention to the fruits and vegetables, make sure that they had access to fruits and vegetables, and make sure that they weren't breaking the bank trying to buy them. So we, working with the residents and hearing what they wanted, one of the things we were able to do a couple of years ago is build victory gardens. We were able to access a grant where victory gardens were built in neighbors' backyards throughout the community. And victory gardening, if anybody knows the history of victory garden, after World War II and everybody came back from the wars, there was a shortage of food and a shortage of money, and victory gardens were built all over the United States. Particularly, they were built in Woonsocket in the Public Housing Authority, right in the neighborhood of Woonsocket that we work in. So it was kind of getting back to our roots, realizing that building these victory gardens has an effect on people's pocketbooks as well as an effect in their health, and that project is still ongoing. We continue to build more gardening spaces throughout our communities. A lot of the work that we do focuses around youth. We have a very strong out-of-school time program in Woonsocket, but also in Burrillville and North Smithfield. And one of the programs that we run in our youth program, which is funded through the Youth Wrap grants at Rhode Island Housing and also through the Hasbro United Way Summer Learning Initiative. Our youth programs have had a major effect on our community. Our kids are getting educated on leading healthy lifestyles. They're learning to move around more and exercise more. For instance, some of the things that we do with our kids, our community center that you saw, the C3 Center, is right on the Blackstone River. And we're bringing the kids out in canoes on the river. They're learning how to swim, they're learning how to canoe, they're learning how to take care of the river, which is huge. The Blackstone River in Woonsocket has a history of being polluted and being a very unhealthy place. Very unsafe place, a lot of high risk of cancer for people who had wells along the Blackstone River. So the kids learning how to take care of the river and make the river a source of health in the community instead of this horrible eyesore that it once was, and getting out there and getting some exercise on the river and having a good time. We have our kids involved in one of our classes. I mentioned the the Healthy Lifestyles class. So the Healthy Lifestyles class, we teach everything, soup to nuts, about body image, about sex, about exercise, about nutrition. So that class is one of our signature programs. We've been teaching that in our community for 10 years. In 10 years, we have not had a single teen pregnancy with the kids in our youth program. So we know that health education works, and health education might not always be the traditional form that's taught in the schools. We actually have a really good time with it and make it more of a play class where the teens aren't as embarrassed or self-conscious about discussing issues of health. With our seniors, we have a senior development in North Smithfield. The Meadows was built around the model of aging in place. And what was really interesting is when we first built the building, every single apartment was handicap adaptable, and we had this, this aging in place theory. It was still kind of a new theory at that time. We didn't know how well it was going to work, but we enriched the community with services. So we have a resident service coordinator that works there 30 hours a week, who makes sure that there's services on site. There's a daily lunch program, making sure that seniors are getting a good meal. There is exercise programs 3 times a week. We have a podiatrist on staff. We have a physical therapist that comes through. So when we built the Meadows 5 years ago, the average age of the seniors that lived there was 82 years old. So 5 years later, the average age of the seniors that live there is 86 years old. So we know it's working. So a lot of this we really can't do without partnerships. So I really wanted to mention some of the partners that we have. Thundermist Health Clinic is a huge partner for us in Woonsocket, and they're the ones that have the HES grant in our community, but they've done amazing things by like putting a health hut in our schools and really getting out into the community to serve our residents in the community where it's accessible for them. And one of the other things that I wanted to mention is New England Distance Project. I don't know if anybody's heard of them. So Any Distance is a program that we're able to bring to Woonsocket. It's another nonprofit, and they train Olympic training athletes who run, and we were able to provide them housing in exchange for them working with youth in our community. So each of the athletes from Any Distance, they live in our house, they live in our community, they have to run 100 miles a week throughout our neighborhood. So there you see these people out there just running through the neighborhood, and how much that has changed the perception in the neighborhood. And then what they've also done is they've revived the track program at the middle school. So now there's actually, the only sport offered at Woonsocket Middle School is track. Track has become this really cool thing now in Woonsocket, and all the kids want to join the track team. And just the perception and the changing culture of the neighborhood of, the residents who have been there forever remember when it wasn't safe to go outside. The neighborhood was one of the highest crime spots in Rhode Island. And now it's changed to a place where everybody's active outdoors and people are running through the neighborhood and outside gardening, so it's really changed. So my last slide is a shameless plug. I talked to you a little bit about the gardening that we're doing in the neighborhood. So our kids are involved in a grant called Opal Apples. And the Opal Apple Grant is helping them learn how to do vertical gardening. We're able to do a vertical gardening program with them through the Boston Science Museum, and they got totally into it. So they want to start creating vertical gardens in their community so that they can feed the local food banks and make sure that other people have access to the fruits and vegetables that they're getting from their neighborhood. So I'm asking everybody to vote online. We have 9 days left to vote. If you can vote on your computer, on your tablet, on your smartphone, only one vote per device. So help our kids build some vertical farms and stay healthy.
Well, as you can see, it covers a wide ranging of health and community development and neighborhood revitalization. And I just want to thank our panel, Amy and Tina and Marco, for giving us just a little snippet of what's happening around the country, but also what's happening here in Rhode Island. And we have a few minutes now. I'm not sure how many. A few minutes for questions if there are any.
So, third question, there's a commonality between both areas is that you both have one of the oldest housing stock in the state of Rhode Island. And so with the funds that you have, can you give some examples of what's going on with the overhousing? And of course, for lead, talking about lead, lead abatement, lead mitigation, what you all are doing that may be innovative?
You can go first.
You can go first on that one.
Sure. So we have over 350 housing units across northern Rhode Island that we've built for rental and some for home ownership. We've done a lot of rehab work, and we've done rehab of old homes, but also mills that were brownfields into now healthy housing. So every building that we build now is a green building. Even when we rebuilt the Stillwater Mill, which is now called the Clock Tower in Burrillville, one of the things that we wanted to make sure is that those old mills, the windows are humongous, and they weren't built or designed to open and close. But we searched far and wide across the country to make sure that we could get fabricated windows that could open and close to improve the air quality inside that building for the residents. So, I think it's just that part of our mission of a community development corporation to make sure that all of our housing stock is healthy. And whether it's a rehab, which sometimes can be tricky because you come into unexpected things in the development process, but the focus is to remediate it and make it healthy.
I think Oneyville housing is quite similar to, I think we have 118 properties in Oneyville, and then we have the condos, and we also have mills that we're working on. One of our biggest projects right now, we have two, Imperial Knife, which is closer to Manton Heights, and then we also have Paragon Mills, which we're hoping to create a live space work environment. But we do a lot of working with, Childhood-Led Action Program, Environmental Justice League, to really make sure that our residents, our homeowners, are really being educated on the issues, because we do have a lot of homes in that area that have had lead issues. Chipping paint, and there's the whole skew of getting your certificate is kind of, that's not my expertise, so I won't say anything about that. But it's really good that your landlords and your residents really know what their options are if it comes down to it. We also have, similar to Woonsocket, we have created our homes that we sell as green homes. So we just sold a second one a couple of weeks ago, and our third one is almost completed with their construction, and hopefully will be sold within the next couple of months. And we're very strategic about where we place our homes. When we've actually done focus group with police officers who've said, 88 something street used to have so many calls for service, and since you guys have redeveloped, we haven't had any calls for service. So that really speaks to the health, the safety aspect of where these houses are being put up. We most recently have finalized tax credits to continue and complete the redevelopment of 36 units in Oneyville, which will be called Amherst Gardens as well, which will be healthy green homes.
So the question I have is, you've engaged at the front end through assessment a whole bunch of people. Do you actually know whether those people who provided you with input and were part of the assessment phase stay in the neighborhood, or whether they get displaced? Because everybody heard about the wonderful neighborhood that you're creating in Fairmount or Constitutional Hill or Noneville, and they're all rushing in to live there and displacing the residents who can no longer afford the higher rents that associate sometimes with improving conditions in the neighborhood. So how do you track the residential stability of people who were in the neighborhood when you started this work?
I think, there's two things. I think there's a section of Oneyville or Peace Oney that's very transient. You're going to constantly have folks move in and out. With our properties that we own, we don't really have that issue. People tend to stay for longer periods of time. So our resident engagement with folks that live in our housing is a lot easier to track. We've done assessments, especially last spring. We did 200 surveys to residents, door knocking, and asking them their perceptions on health and safety. Where we, as long as they signed a waiver, we could take, their number and their address, their name, to be able to do follow-ups with them in 2 years. So I think that's when a lot of that will come out. Like, are we able to contact those people? And then often people forget that Manton Heights is part of Olneyville as well. So then you have 300 and something units of folks that don't tend to move out as well. They tend to stay in there. So I think it's a little easier in some aspects, not so much in others.
In Woonsocket, we have a pretty stable community. We have a very low mobility rate. A lot of the people that live in Woonsocket stay in Woonsocket. There's generations of families in Woonsocket. And with our housing, we're able to track it, and we know that the average person stays in one of our apartments about 4.8 years.
So you're not worried about the gentrification of.
In fact, we welcome it a little bit. We're doing a lot of work on Main Street in Woonsocket, and Main Street could use a little bit of gentrification.
Bringing people of income into the area would be seen as a plus.
Absolutely, absolutely. Our businesses need it, our Main Street needs it. And what we're actually seeing, which is kind of cool, because we've been running this in-depth youth program for so long, is we're actually seeing our kids that have gone off to college come back and invest and buy in the neighborhood. I think that would be a whole different interesting thing to study to figure out.
Tracking.
Yeah, we track.
And I think that that's the difference with, the place-based community development corporations that build the affordable housing in the neighborhood. They build the neighborhood for the residents that live there, not for, and also then if they use some mixed use, they bring other residents in as well, so you can have a mixed income kind of neighborhood. So I think that's it. Yeah.
When you initially start this process, you start with assessment and you involve all these community members. As you continue, do you have regular meetings, community meetings? Is there some kind of formalized feedback process where they stay involved every step of the way?
Absolutely. I think there's so many other pieces that I wasn't able to really talk about with our limited time, but I mean we're facilitators of the Olneyville Safer Streets Association, which was formerly the Crime Watch, but residents said that made them sound like they were sitting with binoculars watching for crime. So now it's considered the Olneyville Safer Streets Association, where residents come together once a month. We also are charged with helping facilitate neighbor circles, where a neighbor and a facilitator will host a dinner at their home and really focus on something in the community for a series of 3 dinners. We also have created recently the Olneyville Youth Council to get youth feedback into things that are going on in their own community. So there's always some sort of arena where residents kind of can speak to their concerns or, and what I've seen happening a lot lately is word of mouth. So once a resident starts to engage and trust certain people, other residents will send them. So I'll be sitting at my office and then all of a sudden someone pops up, oh, listen, I want you to meet so-and-so. They want to sign their kid up for this. So it's that, there's always that piece of resident engagement that just has to continue in order for your programming to be successful.
Yeah, I agree with everything you said.
And I think that there's a definite, when you look at community engagement, there's a definite ebb and flow. As you know with your own life, sometimes you'll get invested in something and be working in it, but then something else happens in your life and you back away for a little, back off. So, but then you come back. So there is that, it's really hard to have total consistency, especially in the neighborhoods that we work in, because people's lives are so not, there's so much going on in them. So, but you have that ebb and flow, and as long as you continue to outreach and engage in different ways, you're going to get different people in and out during the course of the time.
First of all, I want to say thank you. I think a lot of people know I was involved early on and have been out of Rhode Island for a couple of years, come back into here, particularly from Margot and Toby, sorry.
Tina,
sorry. It's amazing the work that you're doing. It's incredible. But for the people in the room who are new to this, is to remember that all these investments presuppose a place in which to make those investments, and all of your organizations represented up there were very involved in creating, by starting with the housing and then adding these things. You couldn't do all those things. But I actually wanted Nancy to speak a little, because given the situation in so many cities across the country and on the headlines today, whether it's Ferguson or Baltimore, for very different reasons in New York City, there's a lot about what's going wrong in America with communities and police and law enforcement, and you've been involved in these neighborhoods. I'd love to be updated on where we're at and some of the positive stories.
I think you heard one with Tina today about the officers, working in the week-long vacation camp. And I think you found that. I think part of it is I think here in Providence and in Woonsocket both, I think there has been long-standing building of partnerships, and I think that's what community policing is about, and that's what community policing in the neighborhood is about. It's building that trust. It's getting to know one another as individuals and part of the community, and I think that process has taken, well, I've been on the job a little over 11 years now, and began with that and starting to build those relationships. But the lieutenant I worked with in Olneyville when we were working there is now the chief of police in Providence. So we see that this is getting infused. We are now invited into the police academy to talk about partnerships and neighborhood partnerships and how you do that. They've asked me to come in to talk about to the new sergeants who are going to be out in the neighborhoods about how you deal with the community. So I think that's the positive thing here in Rhode Island that's happening, and around the country especially where LISC's Community Safety Initiative, called CSI before the TV show was CSI, it is doing, and that's when people ask us how can this change, how can you do this, that's how it changes. It changes by sitting down at a table, by talking to one another, by really hearing and getting and talking about what's happening, and together working to change the neighborhood. And so that's how I think that it's happening. I think we have time for one more question. Anybody have one?
Wait, can I just share a quick story?
Of course.
As to answer your question, when we were doing April vacation camp, we had 17 young men and women sign up for the basketball camp, and we had the officers rotating in and out, playing with them. So on Friday, when I came to give out certificates, I asked them, what did you feel? Did you know who they were? And I had one young boy who was 15, and I actually knew who he was because I'm actually the chair of the Providence Juvenile Hearing Board, so he unfortunately went through the board for an instance that happened in Olneyville. So, confidentiality-wise, I couldn't say anything to him like, oh, I remember you or anything. But he's the first person to say, when I had the group sitting down, oh, those guys were awesome. Now, here's a young man that had an experience that was a negative experience with police because of the choice that he made. But after that week, he's starting to see them in a different light. Like, okay, they're kind of cool. It's not all about them arresting people or whatever. They're human as well. So I think that spoke volumes to the impact that sort of engagement can have on a community level.
And I think that's a really kind of great way to kind of wrap that up, that everything that we do, if it's policing, if it's neighborhood revitalization, if it's safety, if it's health, it's all about relationships and getting those relationships. And I'm sorry, I got the big zero in the back. I believe we are out of time. Thank you all.